clinic. You're here for your dental cleaning today, correct? Okay, perfect. My receptionist already had you checked in, so let's just go ahead and get started. Any concerns about your teeth? Any sensitivities? Okay, alright, that sounds good. And then I also just wanted to make sure that we had your medical history up to date. Is there anything new that you want me to add, or any changes, recent surgeries, anything like that in the last couple of years? Okay, great. Looks like we saw you. Let me check here on the computer. Looks like it's been just about a year. Of course, we like to get you in every 6 months if we can, but understandably, things have been a little different this year. So, as long as you're not having any new sensitivities or any new pain, then we'll just go ahead and get started with the cleaning and the exam, okay? Okay, sounds good. I'm gonna go ahead and I'm going to put my mask on. Once I have this on, it might be a little difficult to hear me, but if you need me to repeat anything, just let me know, okay? Okay, can you hear me okay? Okay, perfect. Alright, so the first thing I want to do is just have you floss. You can either do that yourself or I can go ahead and help you. That's totally up to you. Okay, I'll go ahead and do that for you then. Here. Go ahead and open your mouth just a little wider. Great, thank you. Great. Doesn't look like there's too much plaque in here, so you're doing a really great job brushing. Do you floss pretty frequently? Okay. I'm going to do the other side here, okay? I'm going to go ahead and do the upper teeth now, okay? Okay, very good. Thanks. Alright, I'm gonna go ahead and have your rinse. Okay, go ahead and rinse that out there. Perfect. I'm gonna go ahead, while I was in there, I did notice that you have just a little bit of plaque buildup on your very back teeth. So I know this tool looks a little scary, but it's not for picking at your gums or, you know, digging into anything soft tissue wise. This is just to kind of scrape the sides of your teeth very gently and then get any plaque buildup off, okay? If you feel any sensitivity, any pain whatsoever, just let me know and I'll stop, okay? Okay. Go ahead and go on the other side, okay? Does that feel okay? Okay, good. Again, just a little bit of plaque buildup, nothing crazy. Okay. Last one here. I think the rest of them. Gonna look. I'm just gonna go ahead and get the fronts here. Okay. Alright, that looks really good. And then I'm just gonna I'm actually gonna take this again, and I'm just gonna look in the backs of your teeth here just to make sure. I don't see any cavities. I didn't see anything on your x-rays, but again, I just want to kind of take a quick look, make sure I don't see anything too concerning. Since you're not experiencing any pain, I'm not expecting to really find anything, okay? Kind of running this over the tops of your teeth here. If you feel any sensitivities, just let me know. that looks good. Okay, that all looks good. The last thing I'm going to do here is just give you your teeth a good brush. Make sure we have anything that I might have cleaned off during your initial cleaning and scraping all that plaque off. Make sure that's all really out of the between your teeth. I'm just going to use a regular soft bristle toothbrush, and then I'm going to use this toothpaste that we keep here at the office. This is Himalaya Whitening Complete Care toothpaste, so this doesn't have any fluoride in it. It's sulfate free and it's gluten free too. A lot of our patients do have allergies, so just want to make sure we're doing the best for you guys. rinse here. Okay, great. Alright, let me just do one more quick glance. No, they look great. I'm gonna go ahead and take my mask off. Alrighty. So everything looks good. Did you have any questions for me at all? Any follow-up questions about your teeth, or questions about any products, toothpastes, whitening products? Okay, yeah. So as far as toothbrushes, like I said, the one that I used is a soft bristled brush, so you can get firm or soft. Typically, people, when you brush your teeth after using your toothbrush for a certain period of time, you'll be able to tell if you are brushing really hard, because the bristles will start to kind of curve outward like that. If your bristles are curving outward, then you're probably pushing really hard, which means maybe you're not feeling as clean, so you might want to use a firmer brush. Personally, I use a firm brush because I tend to brush my teeth really hard. I just kind of feel like I get a cleaner feel when I'm using a firmer brush, so that might be something you can try. As far as the difference between a manual toothbrush or an electric toothbrush, electric toothbrushes tend to get more of a clean because they're covering more of your tooth more rapidly than a human hand could potentially do it. So that's totally up to you. Some of them can be pretty pricey, some of them are more affordable. They're not always going to last forever. Neither do these toothbrushes, but they're really easy and inexpensive to replace. I always recommend, if you're going to use a manual toothbrush, try and get ones that are eco-friendly. There's a lot of plastic in a toothbrush. We go through them roughly every 6 months, sometimes more frequently, sometimes less, but like I said, I would recommend that you kind of try out and see how you feel. But if you don't feel like it's something you want to invest in, it's definitely not necessary to invest in electric. Okay, if you're looking at whitening products, there's a lot of different options. One thing I would recommend is just being careful as far as if you have thin enamel or sensitive teeth. The thinner your enamel is, the more sensitive your teeth are going to be to chemicals like a whitening chemical. So just be careful. I know personally some whitening strips will tend to irritate the nerves in only particular teeth, but it's very painful for me to have a whitening strip on, so definitely don't put yourself through that. We can always whiten your teeth here in the office. Of course, insurance isn't going to cover that. It's going to be a little more expensive, but it's definitely something that you can look into. Any other questions? Okay, great. If you have any questions, feel free to call the office, call our receptionist, or you can ask to speak with me. Otherwise, make sure when you go up to the front desk that you schedule out an appointment in 6 months, okay? Alright, thank you so much. Bye-bye.